So this is not Dr. Preeti, this is Preeti. And I am going to share my story, my emotions, the way I really felt. And I'm sure Dr. Naomi will connect with me, though at not that extent. But I think even such simple numbers shook me from within and made me go deeper in my practice and what I do with my patients. So don't put that doctor there. Listen to this and see what connects with you. So 50 years old female, my mom has always been hypothyroid since I've known she's been on that medicine. All my masis who are maternal aunts and a lot of my cousins are on Thyronorm today. But I could never believe that I could be hypothyroid. Never, ever, right? I was a diabetic. And all those who know me also know that my diabetes, my weight, and I think my migraines, my fibroid, they were the reasons for me for coming into functional medicine 9 years back. 2012, I was 88 kgs. My HbA1c was 6.5. And in my family, all my paternal aunts were very obese. They were 100 kgs plus. They were diabetic, had a lot of diabetes complications. So me and my sister are shared shit scared of being a diabetic ever. And when the HbA1c came to 6.4, 6.5, and my weight was not budging from 88, I used to call myself a batata bada. I came into functional medicine, worked on my diabetes, brought my insulin resistance back to normal, and was celebrating, patting my back that all is well. My migraine had gone away, fortunately. I had lost weight and I'd come down to 64 kgs, which is where I wanted to stick down to. And suddenly, when this layer of my diabetes symptoms went away, I realized I'm still not as active as I wanted to be. Still not as fresh I was wanting to be. And one thing which I was not able to solve was my fibroids and my heavy bleeding. And now after hearing to, such a length, all the three speakers and all of them have shared that those are connected with thyroid. But somehow I missed that. But what happened, I was doing my functional medicine exams and they were quite stressful because I took them in US and different place, different teachers. At this age, you are actually stressed out. And I suddenly realized that I was feeling anxious. Little things could make me cry. And I came back and tested for my estrogen, progesterone, cortisol, DRS, and realized that I was into adrenal fatigue and was surprised to see my numbers, how my adrenals were functioning or how I was functioning, So you would think, why go so slow? I think I'm a hardwired allopathy doctor, right? So even when I had helped reverse 30, 35 of my diabetic patients, I used to come back and tell my husband, I don't know what they are doing, but diabetes is not reversible. So it took me a long time to start saying diabetes is reversible. And therefore, in my story, you will see that for everything, I resisted a lot. But when my body did not budge, I moved into functional medicine concepts and I healed myself slowly and gradually over the last 9 years. So I started working on my adrenal fatigue, improved it, worked on my hormones, did progesterone cream, did testo cream also for a while, did my DR supplementation, worked on my cortisol. But I was in a denial phase that I cannot be hypothyroid. And that denial was because maybe I always saw my mom never at her optimum and always having to pop that pill in the morning. And I'm not a pill-friendly person at all. But Dr. Darrell visited me 3-4 years back, I think 2019, almost 4.5 years back. And that's when he said, do your Thyroflex. I waited and did my Thyroflex in 2021. 3 years back, and this is what my report was. So my reflex was very, very, very slow. I knew I was slowing down at my mental level. Pre-fire was very high. My resting metabolic rate was low. And Dr. Darrell said, your thyroid is not optimal. I will show you. Till then, I always used to do my total T3, total T4 and TSH. And they were less than 5 always. And I thought, I am good to go. I don't have to start my thyroid supplementation. If any one of you can connect with me here, do give me a thumbs up. So this is the difference that I saw. In conventional, my mom and my aunts and everybody around me was treated as one size fits all. You give Thyronorm and then you are not worried whether the patient is all right or not. Whereas functional medicine is customized treatment. In conventional, only TSH levels were tested, at the most total T3, total T4. But when I decided I want to work on thyroid through functional medicine approach, I started doing my free T3, free T4, total T3, total T4, my antibodies, and of course my cortisol and progesterone and estrogen and ferritin and alkaline phosphatase. Outdated reference ranges, whereas here we use optimal reference ranges, and patient symptoms are very, very critical. So in my Thyroflex form, when I did this test, I was scoring 28 points in my hypothyroid symptoms, 4 points in hyperthyroidism, 5 in my adrenal symptoms. But my conventional doctor and conventional mind said, just ignore, your values are okay. All thyroid diseases are treated the same. And if our thyroid levels are within the range, symptoms are not considered at all. Whereas in functional medicine, you know by now that we look at stress, infections, toxins, and other triggers which we are there. We are given a prescription of levothyroxine. Whereas here we decide whether we want to give levothyroxine, whether you want bioidentical, whether you only want to give T3, or you first want to address the stress, that's the adrenals, and then 6 weeks later, retest and decide how you want to start supplementing thyroid. You know, after you are done adrenals, after you're done your deficiencies, you actually then decide what thyroid medications should be. Diet and nutritional interventions rarely considered in conventional standard of care. But in functional medicine, they're very, very important. And we've moved a lot away from saying that you don't have to do cruciferous vegetables. We now know for sure that cruciferous vegetables in cooked form are important. Because I just mentioned alkaline phosphatase. For liver, cruciferous vegetables are very important. And liver plays a huge function in optimizing your thyroid health. So let's manage being sick is what we want to say in conventional standard care. But in root cause, we're very clear that we want to say we can get better. Attitude is condition is irreversible. Now we say patient, this is reversible. Of course, remission can happen, but that can happen in any situation. If you have typhoid today and you are treated, you are not told that now you can have typhoid anytime, but you definitely can have typhoid again and you will be treated again. And I think that's the same case with thyroid or diabetes or autoimmune conditions. Medication and management is lifelong. In root cause approach, you can actually get rid of medicines. And even if you can't get rid of medicines, you can definitely get rid of symptoms. Right? So with all those symptoms, I was working on my thyroid, but suddenly last year, I had to repeat my Thyroflex again and again. because my symptoms were not going and I was not able to get up in the morning. I was used to getting up at 5 a.m. and now I started getting up at 8 a.m. And whatever I did, I was not able to get up early. I was again gaining weight. I was having lots of body aches. I was not able to even focus while I was doing consultations, which was very, very, very unusual for me. People who know me, I think on the spot. I don't take time to make decisions, but all of that was changing for me. If you look at my thing, my reflex had gone as high as 322. That's the amount of, brain fogging and slowing down I was experiencing. And my resting metabolic rate was not improving at all. It was at 1721, 1777. I will show you my reports. This is the time I thought that something bad is happening. And I discussed it with Dr. Darrell that time. And I said, let me do my antibodies. I did my antibodies. And yes, anti-thyroglobulin antibodies came positive. Before this, I had started from 1 grain to 2 grain and reached 3 grains of bioidentical thyroid. Because every time my Thyroflex was changed, my parameters off way. And Dr. Darrell and myself used to think we are still not on enough thyroid. And I like the smile on Dr. Naomi's face because I know she's connecting on what I'm, sharing here. But suddenly I realized, no more increasing my bioidentical thyroid. Something more needs to be found. Did this test, was wrongly diagnosed as Graves. Stopped all my meds and did not think about my disease for 3 days. Because I was so upset. I was miserably upset with myself, my body, and the treatment protocol I was following. I'm sure a lot of you can relate to that. When reports don't come as, to the effort you're putting in your treatment. Now, you all know Th1 predominance, Th2 predominance, and anti-thyroglobulin antibodies clearly indicate that there is inflammation in the body. There is fire in the body. And I stopped all my medicines, retested myself, ruled out all the causes which could be there, right? Did my gut health and started looking at all these factors. So I did my oligoscan, found I was low on iron, I was low on iodine, I was low on selenium, I was low on zinc, I was low on vitamin D. Did oligoscan, and there again I found I had extremely high mercury and lead. So I had high mercury 3 years back also. I had done oral chelation, but it seemed that had not helped enough. So immediately I started with IV chelation, vitamin C drips, and supplementation of these. I improved a little, but not there where I had to be. I checked for my cytomegalovirus, Epstein-Barr virus, H. pylori infection, did my oxidative acid test, figured out my IgE was high. New parasites and some infections were creating havoc. Did parasite cleanse, brought my IgE down to normal, stopped gluten completely. And when I stopped gluten, actually internally I was laughing. You know why? Because 9 years back, I had tested myself for lactose intolerance and I was completely lactose intolerant. And I had quit milk. I had shifted to coconut milk, almond milk, and sometimes A2 milk. One of my psychiatric colleagues, Dr. Aarti, kept telling me, Preeti, you will be gluten intolerant also. And I said, no. Gluten suits me perfectly well. Right? But this time I had to quit gluten and immediately I sensed improvement in my parameters. Of course, in addition to what else I was doing. Toxins were taken care of. For stress, I incorporated breathing. Now, I've always thought that the best way to breathe is deep breathing, a deep abdominal breathing. But this time, thanks to Dr. Mahesh Jayaraman, whom I reached out after I was given wrong diagnosis of Graves' disease, and I was very disturbed. And I said, I need you to work with me. I know what I'm aiming at. And in April, in this summit, and this conversation I had with him in December, I said 4 months I'm giving to myself. I have to report no antibodies, normal thyroid function, and on no thyroid medication. Right? And I'm so happy. Day before I tested, antibodies came out normal. I am on no thyroid medicine in the morning. But for 4 months, I did a lot of basic work on my health. So the first thing I did was I started on holotropic breathing as advised by Dr. Mahesh Jayaraman. Now, holotropic breathing, what it helped me do was improve my oxygenation. Now, here my history is very important. I had TB when I had just passed out of my college, which was about 30 plus years back. After 7-8 years of having TB, I became an asthmatic. I reversed my asthma 9 years back when I came into FM. But see, that immune system being compromised, I had suffered from such episodes before. But I had never worked on balancing my TH1, TH2. So I did that, improved oxygenation of my body through holotropic breathing, worked on my gut health. How? Of course, I checked for all infections, worked on that. I worked on leaky gut by using leaky gut care, by incorporating bone broth in my diet, by doing parasitic cleanse. But very, very important, I did 2 very basic things. One, I used ions, a combination of ions, to balance my electrolytes in the body. One. Second, I used Celtic salt. I improved the quality of my salt, reached up to 6 grams of Celtic salt every day from 7 a.m. to 4 p.m. In the beginning, I started having loose motions the moment I increased salt in my diet. But I knew body is adjusting something, body is detoxing. I continued, and in a week's time, that settled. Then I added some herbs, a mix of 12 herbs to balance my gut microbiome. So I was deficient in magnesium, did that, zinc. I was making less acid. So did some exercises to improve my acid and also added betaine for 3 weeks so that, my digestion could improve. The simple clue why I had to add zinc and betaine was I was getting undigested food in my poop, right? So I used a bit of iodine because according to OligoScan I shared, I was low on iodine. For inflammation, exercises I did yoga. So close my mouth and do Om chanting with all focus on my thyroid. I did it 5 times every day. Parasitic cleanse. I did TH1, TH2 imbalance was sorted. Adrenals taken care. My alkaline phosphatase in the last 5 years, I'd never seen it less than 138. It used to vary between 172 and 138. I had lost all hope. But then it came down to 43. After zinc and acid, this thing, yesterday's report, it is 71. And that's where I wanted it to be. Of course, my mercury and all came down after IV chelation. We've already spoken about iodine and all. Vitamin D, I told you I took it, and that we have spoken. Estrogen dominance I worked on by taking progesterone cream and working on media. So this is how my numbers look like. I did not have time to plot them in graph, but I still wanted you to see. In 2019, I used to be always, my hemoglobin always used to be low. So 10.8 was good for me. Now I'm between 12.8 and 12, which is like, I am very happy. My MEB in between reached to 15 in April of 2023. Monocyte, eosinophil, and basophil. Definitely telling me something wrong in my gut. It's come down to 8 now. My TSH, yes. Now this is very interesting and I want you guys to focus. In 2021, I think I've missed one report here. I started with iodine here because I had fibroids, I was low on iodine, and I had other symptoms of iodine deficiency. I reached to 25 and then 50 also. The moment I started iodine, after 6 weeks, my TSH came to 10.4. That was the first time I moved back and said, I am doing wrong. I don't trust FM. Right? But then after 2-3 days of thinking, educating myself, speaking to 2 of my doctor colleagues, I realized that I was a big fan of baked products. And that would have led to high bromide in my case. Also, first oligoscan I did then, I saw my fluoride was very high. So when I added iodine, of course, my bromide fluoride would have got replaced. TSH levels went up. So I did not stop iodine. I continued with iodine and slowly it came down from 10.7 to 8, then 5. Of course, I was using bioidentical thyroid there. It came down to 0.91, then again 4.4. And here is when I stopped iodine and thought I've done whatever I could. Now this again here, when I showed you 2 reports where my Thyroflex was not going right and I was diagnosed as Graves. I stopped all meds for 3-4 days and did my test, and that is where I was 12. Then gradually I started my meds, 6.8. Yesterday's report, I'm 3.4. I promise in next 2 months, I will bring this to 1.5. But this is where I am. See, till the beginning, I was only doing total T3, total T4. But in 2020, I first time did my free T3 and now that's what I do. My DR iron improved. My ferritin improved from 11 to 42. My cortisol. Now this was huge for me. I told you in 2020, I started working on my adrenals. 11.6 with DR only 48.5. I worked on this in 2022 when I checked, my cortisol came to 17.2. I was happy because from low at least I was high. 20 it went to and then came to 13.5, 13.9, 13.6. My DR without supplementation today is 100. So I know that whatever journey I've done for last 3 years has helped my body feel better. My anti-thyroglobulin antibodies were 172. Sorry, this number is not right. When I checked it after the Thyroflex 4 months back, now it is 3.6 in yesterday's report, which is well within range. Anti-TPO was never high. I had done it long back also and 4 months back also. So anti-thyroglobulin is where I was stuck, and that's where I worked and found it. So I did all these tests for myself because I knew these are the cases. Now, what additional things I did which helped me? I did grounding. So grounding, I have always been a fan of grounding. 30 minutes walking without my phone in the morning on grass or mud. But I suddenly realized in my case that was not enough. So I bought a high quality grounding sheet and started grounding myself in my clinic with this small device and at night with that sheet for 8 hours every day. And I could immediately sense the first change. Swelling in my legs was gone. In 3 weeks, I was able to get up, of course, with everything together. But I personally know grounding played a huge, huge, huge role. It's a perfect antioxidant. This is another thing which I used on recommendation of Dr. Mahesh. I had never done this before because, again, very strongly allopathy doctor wiring there. Castor oil on my neck and on my eyes twice a day. I think it helped me regenerate my thyroid, which because of my antibodies and adrenals and everything, I had really compromised its functioning in the last 3-4 years. So castor oil, it promotes oxytocin, it helps you relax, it stimulates meridians, it balances inflammation, it promotes lymphatic drainage, which was my problem off and on for many years. Whenever I used to work on it, it used to be better. I used to stop working on it, it used to go off. So dry brushing, infrared sauna, and lymphatic massages what I did very, very religiously. Enhance vagal tone, circulation, and balance hormones. So I really did focus on my lifestyle changes this time, guys. And I realized that I did IV drips, I did IV chelation, I did hormones, but till I intensively changed my lifestyle, the results phenomenally changed by 180 degrees. I always used to say that base is my lifestyle, but this time I surpassed my expectations. And I realized it's not difficult. Having 7 grams of salt, I kept it in my clinic on my table. And every time I used to add water, I used to add the salt. So I never forgot about it. Similarly, certain things on my bedside, but it was easy. The last thing I did was I made L-Reuteri curd. And if I was not able to use L-Reuteri curd, I took it as a probiotic. There's a lot of documentation saying it decreases inflammation. And in my case, it definitely contributed to me getting up happier, improving my reflex and everything. For the first time, my reflex came down from 355 to 172. Remember, this is 1 month back report. No thyroid supplementation at this point of time. For the first time, I saw my RMR in 80s. I'm sure now I was not able to do it today morning. I will do it and share it with you. But I'm feeling as if it is 1900 plus because whatever weight I had gained in the last year, it's without anything, it's come down. So I worked a lot on my hydration also. I structured water with a crystal. I added salt on it. Whole day I drank structured water. I made sure 4 liters of water is what I drink. So hydrating myself was extremely difficult for me because I have always been one who drinks very less water. But I did that. Breathing, of course, I've told you, holotropic breathing. I couldn't hold it for 10 seconds also. And finally, now I can hold it for 50 seconds. Ashwagandha, balancing electrolytes, yoga practices, and diet. Lot of green veggies in my diet. No gluten, 2 Brazil nuts every day. So what I think I learned from this is, one, I realized that health is not something which you can get like this. It will take time. You will take time to understand your body. Only then you will be able to do everything you need to do for your body. And when you do show that self-love, you will be amazed at the results your body will show you. Amazed. And I'm telling you, amazed. Right? Because that's how I feel now. It's okay to feel low. It's okay to stop your meds for some time in between. But what is very important is decrease that time from weeks and months to days and hours and get back on track. journey again, revisit your journey and never self-treat. Use comprehensive approach. Another thing I did was I actually charted down what relationships are wrecking my life. And I worked with my coach to get them out or build boundaries around those relationships. I don't know how many of you can connect with this, but this is very powerful. I went on a 9-day retreat to Rishikesh and did this boundary making exercise there with my spiritual coach. But I think that also played a huge role in helping me share what I am sharing today. Also, I realized when my antibodies came normal, first thought which struck me was, I am not worried that I have autoimmunity now. It's taken care of, it's gone. It's like typhoid fever. I can have it again if I'm stressed or if I have any other triggers, but I know how to correct it. So guys, I think this was huge learning for me. We have, like diabetes is reversible now. I think autoimmunity is also manageable, but there is no shortcut to it. You have to do everything, whatever your body needs, starting from doing the right testing, starting from changing your lifestyle, starting from rethinking and, doing whatever. Thank you very much. Special thanks to Dr. Mahesh for handholding me when I had decided that I'm going to get off everything. Thanks, Dr. Daryl, for getting me out of the denial mode and making me start work on my thyroid. Because if I would not have done this, I would not have had such a soft, sweet menopause. It has been a phenomenal experience. 9 months now, no symptoms, and feeling so much better. And of course, thanks to Preeti, because I think whatever I did, it was huge. I really feel very good that I could do it. And I am feeling amazing. And a shout out to all those who think that they cannot bring their antibodies down. You can. My journey was 3 years plus. Your journey can be longer or shorter, but I promise you can do it. Just be on track. Just keep coming back on track whenever you go astray. Thank you very much.